been some slight improvement that we've noticed, and I'm going to show you a couple of gating criteria slides to make that point. But the new proclamation that I have already signed that will go into effect tomorrow will keep the status quo going forward. We'll stay in the modified phase 2 with all the current restrictions and limitations. The mask mandate will remain in place, and that order will be effective for 21 days. If you look at the November the 20th, just to remind you what things look like when we made the decision to go back to a modified phase 2, you can see where COVID-like illnesses were largely increasing, but more importantly, cases and hospitalizations were increasing all across the state of Louisiana, made it obvious that we needed to reimpose some of the restrictions that had been previously lifted to give us a better opportunity to create the distancing that we need in order to remain safe. And that's why we reduced those occupancy limits. If you move forward to the data that we had available to us as of December the 20th, you see it's a much more mixed bag. COVID-like illnesses are plateauing or decreasing across the state. Cases are, for the most part, increasing, but in a couple of places, or 3 places, regions I should say, decreasing, and a plateau in Region 7. And then hospitalizations increasing in most regions as well. And so for that reason that we know that we've still got a lot of work to do, and for some additional information I'm going to share with you on the next slide, that is why we elected to stay in the modified phase 2. So this is the graphic representation of where we are as a state on those same gating criteria with COVID-like illnesses being reported to emergency rooms across the state of Louisiana, and you can see that we're in an elevated plateau, most recently declining somewhat. Then if you look at the top right, you see cases. Now, one thing you should know about the red and the green indicates that you're doing better, and numbers are decreasing over time. Red means that you're going in the opposite direction. You see we've got a very long sustained period of red, and you can also see that the average cases now that we're reporting are higher than they were either in the second surge peak or the first surge peak. So we have a very, even though it appears that we're starting to plateau, we're plateauing at a very high level. That is concerning. And then in the bottom right slide, or chart I should say, you can see the hospitalizations. We are slightly above the peak hospitalizations that we experienced in the summer surge, the second surge. Today, I'll tell you the current number is, I think, 1,647. And so that is a concern. And they're also continuing to increase, but at a slower rate than what we were seeing a month ago. And then in the bottom left-hand corner, you can see that the percent positivity is the graph at the bottom, and it's slightly lower for the most recent week. In fact, we declined from 10.2% test positivity, I should say. I'm not sure why I can't speak today, to 9.3%. Still higher than we want it to be, but that is an improvement. And that's very important because, as we all know by now, test positivity is the earliest indicator of what you can expect to happen going forward. So hopefully, if this pans out, we will see that reduced positivity show up in terms of reduced cases. When you have reduced cases, you're going to have reduced hospitalizations, and when you have reduced hospitalizations, you're going to have reduced deaths. And those things haven't all come into play yet, but that's what we would very much like to see going forward. So in short, we're staying in the modified phase 2 for another 21 days. It remains a very perilous situation for the state with respect to COVID, and that's because even if we're doing better, the caseload, the hospitalizations, the deaths are at a very high level. And then we also have Christmas coming in just a few days, followed a week later by New Year's. And so if we insist, and I hope we don't as a state, but if we insist on traveling and having those holiday-related activities and gatherings like we normally would, then we're obviously going to be in even more trouble. And so we're asking people not to do those things. So this means the mask mandate will stay in place. The current occupancy of restaurants will stay at 50%. Bars and parishes with a percent positivity of above 5% are going to be closed to indoor consumption. Gatherings indoors are limited to 25% of the center's capacity, or 75 people, whichever is most. I'm sorry, the fewest, I should say. And restrictions are going to remain in place. You know, and this was emphasized on Monday, by the way, in our most recent telephone conference call that we did with the Vice President and the White House Coronavirus Task Force. And much of that call had to do with vaccines and vaccinations and so forth. But there was a very heavy emphasis on the fact that we have to do everything we can now to try to minimize the spread and flatten the curve again until we can get people vaccinated in large numbers, which will take some months from now. So social distancing remains critical, especially indoors. And I will tell you, as far as the state governments, we're going to continue to have many of our employees work remotely. I encourage private sector businesses to do the same to the extent that you can. Have your workers work remotely. And hopefully you can do that as much as possible, you know, in the first part of the year, certainly through January and probably into February as well. It would be a very good idea. Did want to also mention that today, pursuant to a request from the Secretary of State, I signed a declaration that an emergency exists for the February, March, and April election dates for 2021. Haven't yet seen his specific emergency plan, but I anticipate that I soon will, and look forward to receiving it and working with him and the legislature to make sure that we can have safe elections early next year. Speaking of next year, I do believe that there is a light at the end of the tunnel, and it's coming to us by way of the vaccines and more precisely by vaccinations. But it really isn't here yet. And while there are the earliest signs that we're doing better, and you saw the mixed presentation there on our gating criteria, because of those very elevated numbers that we talked about, we are in a perilous place. Biggest concern to me are the hospitalizations that I reported, which exceed 1,600 current patients with COVID-19 in hospitals across the state of Louisiana. And then I'd like to point out that yesterday we had the single highest 24-hour report for deaths that we've had since July the 29th. We reported 65 new COVID deaths yesterday, and that's very, very troubling. It's my understanding that COVID is now the leading cause of death in the United States of America. For today's report, we are reporting 3,705 new cases on 46,522 new tests. The 1,647 people are hospitalized. That's up 57 from the previous day. 181 of those patients are on mechanical ventilators, and that's up 7 from the previous day. Very sadly, we are reporting 51 new deaths for a total of 7,158. So let's just pause there for a second. Here we are just about to go into Christmas. Since the start of the pandemic, we've lost 7,158 of our neighbors, our loved ones, our friends, our co-workers. It is hard to wrap our hands around a number this large. It's quite frankly unfathomable. This death toll is higher than the number of deaths caused by accidents, stroke, diabetes combined in Louisiana in 2017. And it also means that as we head into this holiday period, there will be that many empty chairs in homes around dinner tables and so forth. And obviously, our goal going forward and the promise of the vaccine and therapeutics and improved practices in our hospitals and so forth is to minimize the death going forward. And we have to do that not just as it relates to COVID patients, but for everybody who needs life-saving care. All right, at this time, I'm going to ask Dr. Cantor to come up and share with you all some prepared remarks. If you have questions for him, please ask those while he's here. I will come up after him conclude my remarks, and then I will take your questions at that time.
Good afternoon. Thank you, Governor. Happy holidays. Thank you for all the leadership that you've shown throughout the course of this crisis. And hope everyone is prepared for a happy and safe holiday season and a good Christmas. We wanted to share one piece of nice news. We have a nice dashboard that was added to the LDH website today. I think most folks have already found it. If you haven't, I'll show you what it looks like. It'll show you what numbers of vaccine has been administered to date. So it's a nice way for folks to follow along with our efforts going forward. It'll show you how many people initiated the vaccine series, how many people completed the vaccine series. Of course, that number is 0 right now because no one's gotten a second dose yet. It'll show you how many providers are enrolled to administer the vaccine. It'll show you what phase we're in the vaccine rollout. It's exciting to me for a couple of reasons. You know, this is, looking forward, this is where it's at. You know, this is every person that gets the vaccine from here on out. It is not only going to be a potential life saved, it's going to be one step closer to putting this pandemic behind us. And we've talked about it before, that the vaccine is the off-ramp. It's how we get out of this pandemic. And as we watch those numbers go up of people that get the vaccine, it's like watching the mile markers go down as you drive south. One step closer to where we want to be. And as we look forward to the holidays and the new year, I think that's a very encouraging thing for people to think about, that the end is in sight, and each day we're going to be able to see you know, how much closer that is. This dashboard is going to be updated on Tuesdays and Thursdays to start out with. It's fairly simple right now, and I expect, just like with the other dashboard, we'll be adding features and adding more data as we go along with this. And we'll let you know about that every step of the way. The other message, though, as we continue to talk about the vaccine and, you know, are excited about it, I personally know probably at least 40 or 50 people, colleagues in the hospital that have gotten the vaccine last week. And that, to me, that's really exciting. The challenge, and particularly from a messaging standpoint here, is that, as the governor said, we continue to be in a very dangerous place in Louisiana. And every piece of data that we see lets us know that it's most likely the most dangerous part of the pandemic for Louisiana. You know, we now, as the governor said, have more COVID patients in hospital beds than we did during the summer surge during July and August. As a raw number, it's not quite where we were in terms of hospital beds during that first surge in March and April, but, you know, back then, patients were spending a lot longer in the hospital when they had COVID, more days on the ventilator. If we were still treating patients back, like right now, like we were back then, the number of hospitalized patients would be even greater. So we have a lot of sick people in Louisiana, and as those graphs the governor showed exemplify, there is a lot of COVID circulating in the community. Every parish, all 64 parishes of the state, have a high level of community spread. That means that if you're going about your daily lives, if you're not careful, and more importantly, if the people around you are not careful, odds are you'll be exposed to COVID. And the governor has said this in weeks past. I've heard it as well from a number of other individuals that I know. People know more people with COVID now than they feel like they ever have at any time in the pandemic. That's a common refrain across the state, and it's accurate. There is more COVID circulating now in this state than there ever has been before, which means when folks go outside of their home, they have to distance, they have to mask. That's the only way to protect yourself. That's the only way to protect those around you. Now, there continues to be some curveballs in this pandemic response, and the news out of the UK the past couple of weeks is an example of that. So there's a new strand of COVID, a slight mutation that's circulating in the UK. They believe it's the predominant strand in London right now. And we have more questions than answers, just to be frank with the people of Louisiana. We're watching this very closely, but we don't know all the information yet. What we do know is that this virus mutates all the time, just like most viruses. 99.9% of those mutations are relatively insignificant, except from an epidemiologic standpoint. Every now and then you get a mutation that's not insignificant, but we don't know yet which one of this mutation will fall in. The questions on our mind are, will the vaccines available remain efficacious against this strand? We believe they will be, but we'll be looking for more data on that. And is it really more transmissible, as people have postulated? We don't know the definitive answer on either of those, and we'll be watching this very closely. Regardless, nothing changes today, nothing changes tomorrow, nothing changes next week. There's a ton of COVID in Louisiana. The risk level is high, and people need to take more mitigating measures, do more to protect themselves and their family now than they ever have before, because this is the riskiest part of the pandemic for Louisiana. There's no way around that. And the governor mentioned about over 7,000 empty chairs this holiday season from people that passed away. The nature of this pandemic is that the death toll is somewhat insidious. And we reported 51 new deaths today. We reported 65 new deaths yesterday. Those deaths add up, and it's too much. And as I reflect on this holiday season, that's one of the things that I'll be reflecting on, is the death toll has been too much. Regardless of the vaccine, which I am more excited about than anyone. At the end of the day, this virus spreads by human behavior. It does not spread if you're far away from someone. It has a real hard time spreading if you're close but wearing a face covering. This virus spreads by human behavior. It only spreads if we let it spread. This virus only spreads if we let it. So my ask to my fellow Louisianans, looking forward to the holidays, is don't let it. Don't let it spread. Don't let it spread to your family. Keep your distance, wear your mask, small sacrifices, keep your family safe. You'll be thankful in the long term that you did. So happy holidays, Merry Christmas. Be happy to answer any questions if there are any. Yep, sir.
There was a report released by the Louisiana Legislative Auditor, I don't know, Darryl Preparer's office, suggesting the slow pace of laboratories reporting of virus test results. I think it was directed towards the Department of Health. Why might there be a delay in getting some of the test results to your office? And is it possible that the low number of cases that came back kind of after Thanksgiving break are possibly inaccurate and worse than what we were told? What do you think about that?
Yeah, we were really happy to see that report. The first thing the report did was validate the data that we're reporting. We really think that amongst all states out there, we have some of the best data reporting, and the report validated that. So we felt really good about that. I absolutely agree. I mean, we really need people that are doing COVID testing, whether that's a clinic or a hospital, to report those results timely to us, ideally within 24 hours. That's our ask. Now, sometimes it's easier said than done because people test in high volumes. Sometimes there's electronic glitches in the system. And I'll tell you, down the horizon, there'll be more and more home-based tests. You can now get an over-the-counter test, FDA approved. And that's going to be even more challenging from a data reporting standpoint. How do we know who's doing that? Those type of questions. So we're going to continue emphasizing that message. And I really ask people, whoever is testing for COVID, it's so important to send those results timely to us because data can always be more complete, which is what the goal is on that. Yeah, Sam.
The ACIP unveiled some recommendations Sunday, I believe, about phase 1B. Can you talk about, are we going to follow phase 1B, what they recommended, exactly where you guys are with that? Are you still reviewing it?
We're still reviewing it, and without getting ahead too much, it's not going to look drastically different from what ACIP recommended. We're still reviewing closely. So the ACIP, the Advisory Committee on Immunization Practices, which advises the CDC, namely the CDC director, they met on Sunday and they voted. What they voted on was to put individuals 75 years old and older, as well as frontline essential workers, in Group 1B, and then they created a Group 1C for individuals down to 65 years of age, people with significant comorbid conditions, and other essential workers. What we haven't gotten yet is the full document that's going to get granular in those recommendations. We expect that to be released hopefully this week in the form of a CDC MMWR, mortality and morbidity weekly reports. Those are publicly available. That's what they did during the other ACEP recommendations. That gets more into the weeds on how they specifically define those categories. So as we continue to have discussions about what our 1B, 1C will look like, we'll look at that document and we'll have those discussions again probably over the next week or two. Yeah, Melinda.
On that same subject, have y'all started doing estimates of who would fall, of how many people would fall in 1B and 1C by the ACIP recommendations, just sort of broadly?
We've started to. I don't think we're prepared to kind of talk about it more broadly than that. I'll tell you, there's a big X factor in that. And the X factor is how many people are going to show up on day one or day two to get the vaccine. And that's sometimes challenging to plan for. And we're seeing that now in hospitals, to be honest. Hospitals have done their best to canvass their staff and see who is going to show up and wants the vaccine. At the end of the day, sometimes they nail it on the head, sometimes they don't, and they have to scramble a little bit to make sure that none of those dosages get wasted. So that'll be the work cut out really over the next week or two.
It just seems like in Louisiana, when you talk to people who have some of these pre-existing health conditions, we're going to have larger numbers of people who fall under those categories. So how do you start sifting through? Do you prioritize within those groups, or how do you start sifting through and determining how many people fall in those categories?
Yeah, it's a big challenge, and you're absolutely right. It's potentially a very large number, particularly in a state like Louisiana that tends to be on the lower section of health metrics. We look at discrete populations, so I can tell you that folks that have end-stage renal disease, that take dialysis 3 times a week, are very close to the top of the priority list, in that they are chronically immunosuppressed and the highest of risk. Beyond there, we're going to look to the CDC to help define which specific conditions they really believe warrant inclusion in what they recommend to be Group 1C. I don't expect that our phases are going to be identical to ACIP, but I think they'll be pretty close. Yep, Sam.
Back to that, so you said the X factor is, how many people are obviously going to get it. Can you talk about what we've seen so far in hospitals? Have more or fewer people than we expected of these healthcare workers actually gotten the vaccine? And also, on that same note, can you talk about rural hospitals, whether they've received any vaccine doses and whether there will be any of these particular challenges for rural hospitals?
Yeah, for the second part of the question, they absolutely have received vaccine, and they're giving out just like the other hospitals are. All the Tier 1 hospitals have received Pfizer vaccine, and for the smaller hospitals that did not receive a direct shipment from Pfizer at our direction, you had to be able to receive 975 or larger to get the direct shipment. Everyone else we took in centrally, we subdivided with our partner, our pharmaceutical distributor partner, and then divided it out from there. The 5-day clock really starts once those trucks leave the distribution center. So from the time a hospital gets those vaccines, like a rural hospital, they really have 4 or 5 days to use them before it expires based on temperature. So we found hospitals have been able to do that. There's been a couple instances where they ended the day with a few extra doses and had to reach out for other people that might be interested in getting it in the name of preventing waste, which we absolutely encourage. I think they've done a good job doing that. The first question is interesting. It's And the question was, do we have a sense of how many hospital workers are taking it versus how many are not, and what the percentages are? I don't think we're going to get good signal on that the first week, because I think the first week, it's still limited dosages for hospitals, and so I think it self-selects for people that are really excited to get it. So I don't have a good number now. I think probably next week or two, I'll get a better sense of that. Yes, sir.
Last question for you. I know that I think on the chart it was around 200,000 people that were part of that first priority group to get the vaccine. I think it was around 30,000 or something like that, of the nursing home residents. I did the story last night that were going to get the vaccine first. But what's kind of the timeline about when we could possibly get these 200,000 vaccines out and move towards that next priority group, pretty much, especially after nursing homes and after our people on the front lines?
It's really just a factor of how much we receive from the feds. And, you know, with the cadence going forward and what General Perna and Operation Warp Speed has told us is that we'll know the week prior to when the vaccine is going to come. And any more out in the future of that, it's just not even worth making projections because it changes. So that's the real X factor, is how much vaccine we get. I'll tell you, we will use, and quickly, every dose of vaccine that we get in Louisiana. We will be ready to use it. The only X factor is how much and what speed of cadence we get from the feds. Thanks, everyone. Have a really good and safe holiday.
Thank you, Dr. Cantor, and I appreciate your work and all the work of the folks at the Department of Health and the Office of Public Health. In Louisiana, I believe it's on the dashboard that you just mentioned, but now that we've added some vaccinations, we're reporting 22,108 vaccinations as of today. And we take that number directly from our links system. And so we have every confidence that many thousands more than that have actually been administered, but there's some lag time between that gets, when the dose is administered and when it gets put into the system in many places. And there's been a few technological glitches and so forth. So we believe the number is actually higher. And we're working through the process of getting all the enrolled providers who are actually administering these vaccines onto links, working out the kinks and so forth. Yesterday, we received our first shipment of the Moderna vaccine, and unlike the Pfizer vaccines that have been coming over multiple shipments, I think they all came in on one day, about 79,500 doses. As expected, this week's Pfizer allotment was less than last week, and it was less than we had been told to expect initially. So we got 28,275 this week, and I think principally those are arriving today and tomorrow. And that's down from the 40,000 that we had originally been told to expect. And the difference is, and I think you all saw where General Perna at Operation Warp Speed came out and said that the original allocation was made based on what would be manufactured, and that was higher than what was actually releasable. And releasable is the word that he used because of all the additional quality control measures that are in place before those doses actually go out. So that accounts for the difference. I previously told you all that we wouldn't comment about how many doses we would receive in any given week until the Friday before, because that's when we were told we would know what our next week's allocation would be. They have now, and when I say they, Operation Warp Speed, General Perna, they have now backed that up to Tuesdays. And so he told us on Monday on our phone call that on Tuesdays we're going to find out what our next week's allocation will be for the Moderna vaccine, the Pfizer vaccine, and as additional vaccines come online, those as well. We then have the rest of the week to place our orders against that allocation to make sure that when the shipments happen the next week that they go to the right places. And that gives us more time to coordinate with all those enrolled providers and with the public as that becomes necessary, so that they know what that next week's vaccination effort is going to look like. And so that is going to be extremely helpful. And so I'm just letting you all know, as members of the press and the public, we believe that now going forward on Tuesdays, we will know what we will get in the following week. Obviously, we'll continue to keep you up to date on vaccine distribution and the next round of priority groups. You were asking some questions about that. These are obviously not easy decisions, and it is, I think this gets back to Melinda's question. It is easy to see where as many as a quarter of our state's population could fall into a certain priority group, and you just can't administer the vaccine to that number of people quickly, especially depending on what your allocations are going to look like. And so we really have to work with this, and we're going to be conforming our plan as much as we possibly can with a recommendation coming from the Advisory Committee on Immunization Practices, that ACIP recommendation, but taking into account equity. So we want to make sure that people have opportunities to get this vaccination when they're in the proper category of priority. And we're also going to take into consideration state-specific data that may not be exactly the same as it is at the national level. So who is it in Louisiana that's going to the hospital and more likely to die? And how does that relate to the data that informed the decisions made by ACIP? And if we need to make adjustments, we will make them. But if those adjustments are made, what I can tell you is they're going to be on the margins. So our priorities will not look markedly different from what the ACIP is recommending, but we're just not there yet in terms of having an announcement for all of you. But if you want a general idea of what to expect, you can look at the ACIP recommendation, and we won't have the actual document that came from ACIP for some time, and that's when the granular data will be available to us. We are working to get more and more of our vulnerable populations immunized, and it's really the same as it has been since the beginning. Individuals are more vulnerable to COVID-19 and more likely to have a worse outcome, including death, if they are more advanced in age, and really that really starts to pick up around age 65 and older, and if they have an underlying comorbid health condition. Now, one of the things we have available to us now that we didn't have available earlier is some therapeutic treatments, one of which is a monoclonal antibody infusion. There are two of these available. One is the Eli Lilly product, the other is Regeneron product. But if you are in one of these high-risk groups because of an advanced age or a comorbid health condition, and you test positive, and you develop symptoms, I'm encouraging you to talk to your doctor to see whether you are a candidate for the monoclonal antibody treatment. Now, in order to do that, it's an outpatient procedure, so your symptoms can't be so severe that you need to be hospitalized. Secondly, you have to do that as early as possible after the onset of symptoms and when you receive that positive test result, because if you wait too late, it's not as effective. But this is a way to keep people out of the hospital, to preserve the hospital capacity, and to save lives. So I am not a doctor, and I'm not up here prescribing it for any individual, but there are a lot of folks out there who don't know that this treatment is available. And from the reports that I've received, both from our hospital CEOs and medical directors in a phone call we had Monday morning, but also Monday afternoon on our call with the White House Coronavirus Task Force. This is a very promising way to prevent people from becoming seriously ill and going to the hospital and dying. So if you're vulnerable, if you have a positive test result, if you have symptoms, as soon as possible, talk to your medical providers, find out whether you are a candidate for the monoclonal antibody infusion. I would also like to point out that this is a treatment that was provided to the president very shortly after he contracted COVID. And I do want to make another plea about this holiday season for people to stay safe. And so typically, this time of year, there's a lot of travel, a lot of activities, a lot of gatherings, multi-generational gatherings, indoors for extended periods of time. All of those things are extremely dangerous when you have a pandemic like we have right now. with a virus that causes a disease. It's easily transmitted, very contagious, and that is causing so many people serious illness, causing so many people to go to the hospital, and causing so many people to die. We really want to focus people's attention as best we can on the informal family work-related gatherings that typically happen this time of year. Office parties, bonfires, family reunions and big meals and New Year's Eve bashes, all are wonderful things. They're a lot of fun. I enjoy those things myself. But the risk is just too high this year. There's too much COVID in Louisiana passing around. We already have too many cases, too many people in the hospital, and too many people dying. So please be safe. I know that it's been a very difficult year. I know that an awful lot of people are tired of COVID, tired of restrictions and mitigation measures. But what we are asking you to do is very consistent with what public health experts says has to be done if we're going to minimize a transmission of this disease, preserve hospital capacity, and so forth. I have been encouraged about some stories that I'm hearing from individuals who are getting creative this year and finding new ways to celebrate and embrace family and embrace the holiday season and so forth. I can tell you my extended family will be getting together virtually, like many others. If you are absolutely set on gathering with others, I'm going to repeat that it's a bad idea this year. Your Christmas this year, your New Year's this year should not look like Christmases and New Year's of the past. But if you just refuse to listen to me, to the doctors, to the experts, just please be clear-eyed about the risk that you are taking, not just for yourself, but for your loved ones and people that you don't even know. And I would ask that you take the precautions to minimize the risk that you are needlessly exposing yourselves and others to. So utilize strict masking anytime you're at an indoor space that is not your house or any crowded outdoor space. And outdoors are always safer than indoors. Those individuals who are over 65 years of age and anyone with a significant health condition should not go into any indoor space if there is a single person unmasked. That comes to us directly from the White House Task Force, and in fact, I think it's the third week in a row that recommendation has been there. Those people in Louisiana, and this is state-specific data, so this is a little bit different than what you see nationally. Those who are 60 to 69 years old in our state are 64 more times likely to die from COVID than those who are 18 to 29. Those who are 70 to 85 years of age are 199 times more likely to die from COVID than those who are 18 to 29. And finally, those who are 85 and older are 667 times more likely to die. Those are staggering numbers, and those are some of the numbers, by the way, that are informing our decisions around priorities for vaccinations. So the best way I think that we can show our loved ones that we do in fact love them and we care about them this year in the middle of this pandemic and given the current stage of COVID in Louisiana is by doing what we can to protect them from COVID. To do what we can now to make sure that they're able to celebrate the holidays with us next year. To keep you and your loved ones safe, so please avoid unnecessary travel, holiday-related activities, parties, gatherings with anyone outside your everyday household. I do want to point out, and it's a good thing on one hand, that thus far in December we're right at 650,000 tests that we've reported. We like people testing because it sheds a light on what's going on. We get more visibility into the disease in Louisiana, in every community and so forth. But we know that people over the Thanksgiving holiday thought they could test their way into a safe Thanksgiving that they would normally have, with gathering with families and so forth. That is a very, very risky thing to do, and quite frankly, you cannot test your way into that, because they test, as good as they are a snapshot at that point in time. And individuals may have already been exposed to the virus, contracted the disease, but haven't yet produced the viral load that will allow them to test positive. And so they're lulled into a false sense of security, thinking they are negative and they don't have it. They gather for extended periods of time with family around the same table, indoors, multi-generational family members, and in fact, the person's contagious. That is not mere theory. That played out here in Louisiana over and over again and across the country for Thanksgiving. And if people insist on doing that for Christmas, it's going to play out yet again. And there will be families gathering at Christmas who will not have a loved one there because of that strategy that was used at Thanksgiving. It's just not worth it. So we're too close to the finish line to make unnecessary mistakes now, mistakes that are permanent and cannot be undone. All right, so with that, I'm going to take a few questions, and then I'll close out. Sam?
Governor, between the Pfizer and Moderna shipments, we were supposed to receive over the past 2 weeks, I think it's 146 and change thousand doses. Do you know how many we've actually received of that? Mainly, I'm asking like this Pfizer second batch, how many we've gotten. And also, you said we'll know Tuesday, the next week's shipments. Today is Tuesday. Do you have the numbers for next week?
Yeah, I'm going to ask Dr. Kenner. I don't know whether he brought those numbers in with him. Do you have those? So he'll come up and give you those.
Sure. Thanks, Sam, for the question. So this week we were due 79,500 doses of Moderna, of which, and I'm going to explain how this works, we divert about just shy of half of that to the long-term care partnership program. So of that 79,500, we diverted 35,900 to the long-term care partnership program. That's the Walgreens CVS program. So that part doesn't actually even come into the state, at least not to our custody. It goes to Walgreens and CVS, and we don't direct it from there. The remaining 43,600 doses, those arrived here at Morrison-Dixon, which is our pharmaceutical partner, yesterday morning. And they are currently being divided up and then shipped out to Tier 2 hospitals, and namely EMS and fire. Next week, we were told yesterday morning to expect of Moderna 27,500. As the governor said, I don't think we're going to assume that's final until Thursday and Friday, but Operation Warp Speed is trying to tell us on Tuesdays now what we should expect the following week. So that's what they told us yesterday.
Are we expecting any Pfizer doses?
Yeah. So Pfizer, this week's allocation is 28,275, and those will continue to come in today and tomorrow. We should get the remaining of those in tomorrow. We have no reason to expect we won't get that 28,275. Next week, we were told as of yesterday to expect 36,075 doses of Pfizer.
Melinda?
Governor, do you have a timeline for when you're going to make a decision on the priorities for 1B and 1C, and when do you personally intend to get the vaccine?
I don't have a precise timeline. We're still trying to figure out what our weekly allocations are going to be, and that's hard because they're not going to guarantee anything further than a week out. We're going to know on Tuesday what we're going to get the next week and so forth. But we're also awaiting the document that comes from ACIP that actually spells out all the detail around their recommendations so that we can take that into consideration and so forth. So we really don't know. But I do want to tell people this is not going to be like flipping a light switch so that you flip on priority 1A, then you turn it off and you turn on 1B. When we get to 1B, we're going to continue to do those hospital workers and so forth that were in 1A that for whatever reason didn't get vaccinated early on. And quite frankly, before we officially get to the next order of priority, there will be occasion when we go out and with some vaccine. For example, it may be for end-stage renal disease or other things for people that would be in priority 1B, but we have those doses available for some reason, and you know, if for nothing else, because we don't want to lose any doses because we weren't able to administer them before they expired. So it's not going to be like you turn on and off light switches, but we are going to have an order of priority, and we're going to focus within those priorities on those individuals who are most likely to have a poor outcome, requiring hospitalization or potentially more likely to die. We will make sure that they're getting those vaccines allotted to them as best we can, and then we will work with the other groups that have been identified and that will continue to be identified. As far as myself, I don't expect to receive a vaccine until we get to that point where we're looking at first responders and some governmental workers who may be the group that runs, for example, our Unified Command Group that we operate out of GOSEP to respond to emergencies and that sort of stuff. Don't know exactly when that's going to be, but that's sort of when I see myself and other key leaders in our state government who would be eligible to receive the vaccine. And when we know more about when that'll be, I'll certainly let y'all know. Yes, sir.
Governor, the number Dr. Tanner just gave suggests we should have 210,000 plus cases by next week. And I know you haven't figured out the next part of the group, but it's only 215,000 people included in the 1A. So I guess I'm wondering, are we going to start giving out vaccines to people beyond phase 1A before we have finalized this?
Yes. No, the answer is yes, and we actually have already started that in small numbers. And who that's going to be, I can't tell you the entire universe, but I can tell you that we're going to get beyond the Tier 1 hospital workers as quickly as we can. We're going to get to people with end-stage renal disease, so those people requiring dialysis, for example, 3 times a week, and they're going to be getting allocations, and we're not able to get all of those groups vaccine right now, but as they become available, we will be able to transition more and more to those next order of priority. And again, we're going to have a lot more information for you later. We're just not there yet, and you're going to keep pressing and pressing and pressing. I'm just not going to be able to be more concrete with what these priorities are going to be. And who exactly is going to be in the order of priority, and when on the calendar we're going to be able to get to them. Yes, sir.
And kind of tagging off of that, any idea of when average people like me or anyone else is going to be able to get one? And kind of, I know you mentioned it with the that special on Friday night that aired about the masks. When do you think possibly we'll be able to take off these masks?
I don't know. And quite frankly, in terms of when we can take off the mask, what we've been told is that the vaccine has been proven 94 to 95% effective in preventing people from contracting the disease of COVID, 100% effective or thereabouts in preventing very serious cases of COVID, but they don't know yet, and there is no data to show that they prevent people from being contagious. And those are 2 different things, and I know that's hard to understand. And so for some period of time, we're going to have to leave the masks on, even after significant percentages of our population here in the state and around the country have been vaccinated. But we're still a long ways from that. And so people should keep their focus on the task at hand, and that is getting the vaccine when you're eligible for it. You should. It's safe. It's effective. It's how we're going to put the pandemic behind us. But between now and when enough people do that, so that we do put it behind us, it's wearing the mask, it's distancing, it's washing your hands, it's staying home when you're sick. And that's true. And for those people who are concerned, and I'm one of them, about this new strand that apparently has been reported on coming out of the United Kingdom, guess what you do to prevent that new strand from taking root and really causing a lot of people to become sick? You wear a mask, you distance, you wash your hands, you stay home when you're sick. You do all of those things. And I believe the vaccine, from what we can tell right now, and we'll know more about this later because I know there's some tests going on right now, but we have every reason to believe that both the Pfizer and the Moderna vaccines will be effective against that new strain as well. And if that changes, we'll all certainly know about that relatively soon. Yes, ma'am. I'll come back to you.
The Supreme Court ruling yesterday, were you disappointed in the procedural decision they made to return that to the lower court? Obviously, you've expressed concerns that the petition issue being out there has muddied the message. And so by sending it back to a lower court and overturning the district judge's ruling, it would seem to continue that situation.
I'm certainly less concerned about that today than I was back at the end of October. Because it did cause some confusion, and quite frankly, some people who were grossly irresponsible went out and promoted something that was simply not fact. They said that there was no mask mandate in order and the restrictions didn't remain in place. The people of Louisiana now know better, and so the proclamation that I will issue tomorrow will be valid and in place. The mask mandate's part of that. The restrictions we talked about earlier are certainly part of that, and they're essential to managing this public health emergency. You know, I'm not going to say that I'm disappointed. What people should understand is the trial court ruled unconstitutional the effort to end the public health emergency by a group of folks in the House of Representatives. There were other preliminary matters that the court did not rule on, and the Supreme Court didn't take the trial court to task for anything he did. They just said, we need you to rule on these preliminary issues, and I think the big one is whether the consultation happened as required by the statute between those members of the House who created that petition and signed on to it and the Department of Health. And so, you know, I'm not surprised as a lawyer. I know that all the time courts try to rule on something other than the actual constitutionality of a statute. And if there is a way for them to resolve this matter without getting to the constitutionality of it, I think that's something that they often do. I have no doubt, standing here, that the consultation required by the statute was not carried out. There weren't members of the House asking the Office of Public Health and our epidemiologists and our public health experts what they believed was necessary in terms of managing this public health emergency and the global pandemic that is COVID-19. They simply didn't do it. In fact, they had already drafted the petition before they ever sat down with them, and when they did, they didn't really ask the right questions. It was something that they did just to try to check a box. Secondly, I am absolutely certain that the statute is in fact unconstitutional. And I'm certain that when the Supreme Court, if and when it does, get to that question, they will decide it as such. Quite simply, we cannot have a system of checks and balances where a simple majority of one body of the legislature can overrule the governor on an issue as important as a public health emergency declaration. There are equal and separate branches of government. Those are the judiciary, the legislature, and the governor's office. But the House of Representatives is not the legislature. And it really is just that simple. So I'm not disappointed, and it shouldn't lead to any confusion, but I will tell you, the sooner that they can put this to bed, the better. Yes, sir.
Governor, so throughout the pandemic, there's obviously been a lot of lawmakers who have undermined you on the virus and, in your own words, not taken it seriously. I guess to the extent that those people represent constituents with similar beliefs, are you concerned about the implications on the vaccine Because if you don't take the virus seriously, why would you take the vaccine? And do you think that's going to be a problem in some of these places?
Well, you know, I think there are a number of reasons why people are hesitant to get the vaccine. Some people are against vaccines, generally speaking, and they're known as anti-vaxxers, and that's not new, and they seem to adopt that approach to every vaccine that comes along the way. Other individuals, for whatever reason, have sought to minimize the seriousness of this disease or to dismiss it outright. If they are serious about that and they don't think it's a serious thing, they may not be inclined to get the vaccine. I think that flies in the face of science and what public health experts are telling us. And even if people were inclined to believe that early on, I continue to ask them to change their mind. By the way, they should change their mind on masking too, and distancing. Simply put, it's not an onerous thing to do, especially in light of the damage that can be caused to yourself, to your family, to your neighbors, unnecessarily, by simply not wearing a simple piece of cloth over your mouth and nose. And so I would encourage those people to change their mind about that. And then we have other folks who have different reasons for being hesitant. You know, we have to be honest. African Americans have not been treated well historically in the United States when it comes to medical science, and as things developed and so forth. Now, I think that with respect to current times and the trials of these vaccines that we're talking about now, we had African Americans who participated in enough numbers that we know that the safety and efficacy that we talk about applies to that population. And so we really want them to embrace the safety and efficacy and understand it's really important for them, you know, and probably the case can be made that it's more important because we formed the Health Equity Task Force because we realized by April that African Americans were grossly overrepresented among those who were seriously ill, hospitalized, and especially those who had died. While they were 32% of our state's population, at one time they were almost 70% of the deaths. And so knowing that and knowing how comorbid health conditions are more prevalent among African Americans than others in our state, it is more important, not less important, that they embrace this vaccine. And so trying to get everybody, for whatever reason, to discard any notions that they should be hesitant to take this vaccine or that they should reject it altogether. That's incredibly important, and we're going to do everything that we can, working with the federal government, with local leaders, with public health authorities, with anybody that we can to promote effectively the safety and efficacy of this vaccine and the importance that we all take it. I happen to believe that over time, more and more people will be willing to take the vaccine because they're going to see more and more of their friends and neighbors and relatives who take it, who do well with it, and I think that's just going to inspire more and more confidence. We're always going to have a certain element out there who, for one reason or another, tries to prevent people from taking it or convince people that they shouldn't take it and so forth. And you know, that's sad. But at the end of the day, we need to get to at least 70% of the people of Louisiana in terms of the percentage of our population that's going to be vaccinated in order to achieve the herd immunity necessary to really put this behind us. And if we have members of the legislature, and I know we have, who have been extremely irresponsible to date with respect to their messaging and, by the way, their personal behavior. I hope that they will stop that, understand that this is important, and it shouldn't be political. There's nothing partisan about the disease. There's nothing partisan about the mask. There's nothing partisan about the vaccine. And so hopefully they won't, and they will become more responsible from this point forward. I did want to close out by just acknowledging that it has been a very long, tough, challenging year for our country, and in many ways more challenging for our state than the country at large. For much of the year, we had the highest number of cases in our state per capita than any other state in the nation. At one point in March, we had the highest growth rate of COVID anywhere in the world that it was being measured at that point. It has been a long, tough year. We've had 3 hurricanes. As we gather around our tables, hopefully with our immediate households for Christmas, as we go to Mass and church and the other things that we're going to do, we have many of our brothers and sisters across Louisiana whose lives are completely upside down. Maybe they haven't been able to get back to their home yet after a hurricane. Maybe they're sick themselves because of COVID. Maybe they've lost a loved one, or they have a loved one in the hospital. Maybe they've lost a job, or the income at their business is down from what it had been previously. So this has been a tough year. I am well aware of that. But I do want to thank the people of Louisiana for being so tough, being so resilient, and for the most part, being good neighbors to one another in times of need, whether it's the pandemic or whether it's a hurricane. And I look forward to a 2021 that's going to be better. I'm praying for that. I'm praying for all of our citizens across the state right now, and I encourage others to join me in prayer. And let's lift this state up, let's lift our country up, and understand that even in these very difficult times, we have a lot to be thankful for. And again, I am thankful for the people of Louisiana. And for those people who just do the right thing, put on that mask, who social distance, who embrace the measures necessary to protect their neighbors. And by the way, they're protecting themselves too. Thank you. And for those of you who for some reason have decided not to do that or not to always do it, I'm going to appeal to you to change your mind and embrace these measures so that over the next few months, as we work through this vaccination and get enough of our people vaccinated that we start to end this pandemic, that we also minimize the number of cases that we have in Louisiana, minimize the number of people in our hospitals and the number of people who are dying. That's what it means to be a good neighbor right now. That's how we show love for one another right now. So on that note, I do want to wish everyone a Merry Christmas. If I don't see you before New Year's, and I don't plan to unless something happens, if it does, we will call a press conference for next week. I want to wish everyone a happy New Year. And I'm going to go sign an executive order now mandating that 2021 be much better than 2020. I wish I could do that. I guess I could do it. I'm not sure that it would work. But thank you all very much for continuing to cover this. Thank you all to the people of Louisiana, and we will see you all in a couple of weeks.
But no fly